Morning, good afternoon, good evening, depending on the area of the world you are. I'm Roberto Suarez, the Secretary General of the IOE, International Organization of Employers. Thank you for joining us. The meeting and the event that we are organizing has to do with the uncertainty that the pandemic has brought to us. From the onset of the pandemic, IOE has been trying to mobilize its big network of business organizations around the world that try to provide them relevant guidance on several areas, which have to do with business continuity, with lockdowns, with all kind of measures that has to do with financial survival, financial liquidity, but of course, with health and safety measures, with prevention, but also with vaccination. And it has not been easy at all, and it's not easy at all because there is also a health uncertainty, I have to say, in terms of how to deal with the pandemic. And how to deal with the pandemic at the workplace is even much more challenging than we expected because of the reality of new scenarios when we return. We have been saying and we have been affirming that public health never was such relevant item for business. I mean, the need for collaboration with the public sector on health issues has never been so necessary, at least in the last 50, 70 years. And that's why health and safety at the workplace is becoming more and more a priority matter. And in the ILO, we are going to discuss that precisely. But that goes hand in hand with much uncertainty on how to tackle health and safety at the workplace right now, that we need to provide a secure atmosphere to the workers, but also for business survival and business continuity. Our objective in this event is to provide qualitative information to our global business network and to our companies, and try to get perhaps some certainty based on the vision and lessons learned. And for that, we have high-level speakers, to whom I want to thank from the very beginning, who have been facing the ongoing COVID-19 crisis on a very, very prominent manner. I also want to highlight that the participation that we have today are participation from employers and business organizations. These business organizations have been playing a key role precisely to try to lower the spread of COVID, and precisely to help these companies to deal in a better manner with the COVID-19 at the workplace. With that, we have now the highest international authority on health, which is the WHO, and also an important expertise and guidance, and who have developed an important expertise and guidance on COVID-19. And we want to thank also the ILO and the Director General of ILO, Kai Ryder, for joining us in this event, as he has done also I would say for all the pandemic. He has been very, very responsive to our request for joining our events, and also to provide us important key aspects, important key guidance. It has been said repeatedly that since the pandemic became a global problem, that the world has been profoundly affected by it. The ILO also, and we in the ILO, have been tracking these challenges and trying to see and identify how to tackle them in a consensus manner. This has not always been easy, but we are trying also to get important consensus there. So let's start with an opening remarks, which will help us to have a state of the play and guidance from Dr. Sumia, who is the WHO chief scientist. I think I have to say that Dr. Tedros has designated you, Dr. Sumia, to represent us here. But I also have to say that you have been the Deputy Director General of WHO, and also that you have been, I think right now, the scientists in the WHO that has participated regularly on a weekly basis, providing guidance in in the press briefings that the WHO has been undertaking very recently. Thank you very much for joining us, and I would like immediately to give you the floor to provide us some kind of good guidance or good elements precisely to have a good discussion about that. Thank you very much. The floor is yours.
Thank you very much, Secretary General Suarez Santos, and also Mr. Ryder. Greetings from the World Health Organization and from Dr. Tedros. Apologies that he couldn't be here, but I'm here to represent him, and we value our partnership and relationship with the ILO. And over the last 21 months in particular, we've worked very closely together on this whole issue of COVID-19, because as you just pointed out, it has impacted everyone all over the world. Whether or not you got COVID and got sick, that's one group of people, but it has impacted every single individual, I think, in every country, because the way we work, the way we meet, the way we socialize, everything changed. So I would like to just spend a few minutes perhaps in telling you where we are. I know there's a lot of interest on vaccines, but I just wanted to give a little bit of a high-level overview of where we are in the pandemic. As you know, we are at about 240 million cases, and these are documented cases. And I should mention that for every case that's recorded, diagnosed, and reported, there are anywhere between 2 to 100 unreported cases. And this ratio varies from country to country and even within countries. So that in the United States, for example, it's estimated that the number of cases are actually 40% of the true number are the ones that are reported. But if you go to a poor country in Africa, you go to one state in India, for example, you will find this ratio could be anywhere from 1:30 to 1:100. So that's really the true scale of infections. Similarly, for deaths, we have close to 5 million reported deaths today. And these are only deaths that have been diagnosed and reported as COVID. We know from seroprevalence surveys that have been conducted across the world now, and WHO has been reviewing this from time to time. These studies tell us about antibodies in the blood, which are a way of finding out if people have been exposed to the infection. So these studies are telling us that anywhere from 20% to 60% of the global population, again, varies by country, varies by region, have been exposed. So in Africa, which is the continent with the fewest number of cases and deaths, antibody surveys have shown that 40% of the population have been exposed. And similarly in the Americas, it is up to 50 to 60%. Within a region, sometimes there's a difference between high income and low income countries, but even that is not consistent. So just to say that, yes, a large part of the world has been exposed. And why is it important? Well, there is natural immunity. Once you're infected and you recover, the body develops immunity, which lasts, we think, at least for a year. And people who've been infected, there have been cohorts, the follow-up over a year has shown that reinfections are rare, could occur in about 5 to 10% of people, more common in the older age group, because the older you are, if you have some underlying illnesses, then your immune system doesn't work as well and immunity tends to wane off a little bit. But in general, people who've been infected will have some degree of immunity. Now, 3 things are important: diagnosis, treatment, prevention. Diagnostics are very important, and it's important for workplaces as well. At the beginning, of course, there was a shortage, but now there is actually a glut of diagnostics available. It's important, though, to use quality assured diagnostics. There are a lot of poor quality diagnostics available on the market. So the RT-PCR or the molecular test is the gold standard, but there are a number of rapid antigen tests which can be used particularly in workplaces, for immediate testing and confirmation. And this in many places is now becoming part of the routine of somebody either routinely testing people or doing it when people are coming in with some suggestive symptoms. In terms of treatment, there's very recent, very good news. An oral antiviral
individuals and on community.
An oral antiviral drug developed by a small biotech company, Ridgeback, in partnership with Merck, just recently put out an announcement that this drug, if given early in the course of the illness, so within the first 5 days of symptoms, reduces hospitalizations and deaths by at least 50%. The trial was stopped prematurely because the Data Safety Monitoring Board felt that the results were very good and that it was not ethical to continue with the placebo. The dossiers will now be filed in the FDA and in other regulatory agencies for approval. And Merck has already entered into partnership with many generic drug companies. So hopefully the drug will be available at affordable cost around the world. This is unlike previous treatments we had, like monoclonal antibodies, which also work well if given early, but they have to be administered through an injection, and they're very, very expensive and not available in many parts of the world. So I think people have described this as a game changer. Well, we have to wait and see the full data of the results, but I think this also will emphasize the fact that if you can diagnose, detect early, treat with an oral tablet for 5 days, maybe we will get this infection to become treatable. So let's keep an eye on the guidelines. WHO will also be looking at this data, putting it out as soon as we get the complete data set. Moving to prevention, there's the vaccines, there's the other preventive public health and social measures that we talk about. In terms of vaccines, we have, again, an unprecedented number of vaccines being developed. Currently, there are 6 vaccines, 7 if you count the 2 types of AstraZeneca vaccines that are approved by WHO through the emergency use listing. And there are many more in the pipeline. And we expect over the coming months that there'll be more vaccines coming through the WHO emergency use listing process. So as of today, we have 6.4 billion doses of vaccines administered around the world. About 350 million of these have gone through COVAX, but the majority clearly are being done by countries on their own. There are only 3 countries in the world which have not started immunization programs. But having said that, there is inequity. I think all of you are aware, high-income countries have administered 34 times more doses per inhabitant compared to low-income countries. And 10 countries in the world, including China, India, Brazil, Japan, Indonesia, Germany, Mexico, France, and Turkey have administered 71% of all doses, including the US as well. And 50% of doses actually have been administered just in China and India. If you look at the targets that we had set, Dr. Tedros had said that every country should have vaccinated at least 10% of their populations by the end of September, 40% by the end of December. If we look at where we are, only 1 low-income country and 31 LMICs achieved the 10% target. Most upper-income countries have achieved it. And in fact, many of them have crossed the 40% target, whereas only 6 low-middle-income countries have achieved the 40% coverage target. So we have a long way to go in terms of equity in vaccine coverage. And I hope we have made a lot of efforts working with partners around the world to firstly encourage manufacturers as well as countries that have excess stocks and supplies to prioritize COVAX, which is a global delivery mechanism that we set up last year, so that we can send those vaccines to countries which have very low coverage. Secondly, we've asked all countries to not put in place any export restrictions or customs barriers to the movement of raw materials or finished vaccines across borders. We saw some of that last year with PPE. We saw shortages of masks, PPE, oxygen in many countries, and then also vaccines. So this is something in a pandemic that should not happen. Thirdly, we are requesting manufacturers to share their technology to expand manufacturing capacity, and the WHO has set up the first mRNA technology transfer hub in South Africa. We believe that this is the right time to use this new mRNA technology and build capacity to make more vaccines for COVID, but once the pandemic is over, also this technology can be used for other diseases as well. And then we have, of course, vaccines plus. Vaccines alone, we've seen now from the Delta variant, so maybe I'll say a word about the variants of concern. This is something that is expected. All RNA viruses, in fact, all viruses mutate. And from November of 2020 onwards, we've been tracking from before, but the first variant of concern came up. The Alpha variant was reported in the UK. Very soon after that, the Beta variant from South Africa, the Gamma variant from Brazil, Latin America, and then of course the Delta variant first reported in India, and then currently that's the dominant variant. So 98% of infections worldwide are caused by the Delta variant. It is about 7 to 8 times more transmissible, more infectious than the original virus, which is why you see this exponential growth. And once it takes off, it's very difficult, very hard to control. Even countries that were successful in 2020, countries like New Zealand, like Singapore, like Vietnam, like Thailand, they all got hit by the Delta surge and, more or less had to give up the concept of complete elimination or keeping the virus out of their borders. So what we cannot predict is whether there'll be another variant of concern with even more concerning mutations. Some of the mutations we've seen in the Beta and Delta variant, the Beta and the Gamma variant, are those that can make the virus resist antibodies, either through vaccine-induced immunity or natural immunity. If the virus accumulates enough of those mutations, it can overcome the impact of the vaccines. So far, this has not happened in any of the variants that we're seeing today. All of them are, vaccines are working well, at least against severe disease and hospitalization and death. So when you look at the efficacy of a vaccine, you can look either at preventing infections or you can look at preventing severe disease. So what we need to be clear, because you see a lot of this in the media today, a lot of discussion on waning immunity. Most of the studies today are showing that these vaccines over a period of time cannot protect as well against infections. So, and that may be something to do with Delta as well as with waning immunity. However, they still have high levels, over 80–85% protection against the severe disease, which means that if you're vaccinated, you can get infected, but you will not end up in the hospital, which is what we are most, which is really our primary goal at this point of time. We always say vaccines plus, which means that in workplaces, you need to think about not just if people are vaccinated, and yes, you should encourage everyone to get vaccinated. There's hardly any condition I can think of which is a contraindication for vaccination. So if people are reluctant, I think it's more a question of having a dialogue with them and a discussion about and encouraging them and answering their questions to get as many people vaccinated as possible. And then also follow some of the other precautions. We've seen now that where people got vaccinated and countries lifted all of their other measures, there were surges of infection. So the wearing of the masks, the importance of ventilation, there's still the maintaining of physical distancing, the other hygiene, respiratory hygiene, staying at home if you're sick, wearing a mask if you're in a room with lots of people and you can't maintain that distance. These things need to be continued for some time to come till we get to the point where enough people around the world have protective immunity, and then you can start really, because we've seen variant emerges in one country and goes around the world. So even if one country protects 80 or 90% of their people, they're not safe because they can always get back another variant. So this is why we talk about vaccine equity and why it's important for everyone to be vaccinated and that nobody's safe until everyone is safe. But to come back to managing things in the workplace, I think it's important for now to, and ILO and WHO, put out a lot of guidance of how you can do risk assessment, what are the things to be put in place, and how do you monitor that. And it, of course, a lot depends on what's happening in the community. What's the epidemiological situation in the place where you are? And so it's very context specific. And so one guidance is not going to apply, but the principles and the scientific basis for those policies are provided on our website, on the ILO website, and it was last updated in June. It talks about how do you manage your public health. But again, the message is not to lift all measures all at once, thinking we're free of the virus. We're not at this point. We're never going to be free of the virus as far as we can tell. We're going to transition from pandemic to endemic at some point, which means that we will have this virus just like we have influenza and a host of other respiratory viruses that we live with. And perhaps we'll do better now at managing influenza, which also causes a lot of morbidity and mortality every year, because now we know that there are certain measures that we take. For example, last 2 years, there's been no influenza outbreaks in any country. That's because of the masks and the hygienic measures and the distancing that we've been doing. So we could use the same knowledge. So I like the description of a Swiss cheese model where you have to do multiple things in order for it all to add up and have impact. There's no one intervention in a workplace or in the community setting that is going to be the most important. So maybe I should stop there. I don't know if there are going to be questions or anything, Roberto, but thank you very much for this opportunity. Thanks.
No, thanks to you, Dr. Sumi. It's critically relevant information that you have provided us, even though much of this information we already knew. I think having this overall perspective is really, really helpful. I will come back to you later if you don't mind. You can stay with that a little bit because the WHO has been very cautious about a controversy, which is a mandatory and non-mandatory vaccination. So perhaps if you can elaborate on that. But before that, I would like to have our also distinguished guest, the Director General of the ILO, Guy Ryder, also to provide us some guidance, also based on some developments at the workplace, and also, bearing in mind also the consequence that lockdowns also have had in terms of jobs, in terms of business continuity. So with perhaps a wider perspective, but right now we need also specific insights and how we as members of ILO, as constituents of ILO, can do better and can produce, also some certainty to workers and employers to deal with the pandemic or to deal with the endemic in the future if we finally succeed to overcome it. So guys, thank you again for joining us, and the floor is yours.
Well, thank you very much, Roberto. Thank you for the invitation to be with everybody. Hello to everybody. And of course, I benefit, as we all have done, from listening to my colleague from the WHO, giving us very clearly and very comprehensively the state of play from the health and from the science perspective. It's interesting, isn't it? In the many conversations that we've had over the period of the pandemic, we sort of evolved, when things were at their worst in the world of work, when the world of work impact of the pandemic was at its greatest in terms of hours lost, etc. We were talking very much about, prevention, what we do at workplaces, how we get people back to work, what it would require, and then also what the new normal would be like once we got through this pandemic. And strangely enough, that sort of binary idea that we're in the pandemic and then one day it's going to be finished and we can go to a new normal, life has turned out much more complicated than that. So we're in a situation today, as Sumya has said, where we're having to live with this virus in different ways, and we're having to work out how the world of work can operate effectively, how enterprises could continue to operate in the very difficult and in some ways very worrying conditions we find ourselves. Now, the first thing to say is that we have worked very hard together. When I say together, ILO, WHO, and we thank our colleagues there, with the employers, with the workers, with governments, to do a number of things. One, I think we have a very clear idea on the types of preventive measures, the types of medical protocols we need to put in place at workplaces. I think, need to go through all of that. We have quite a body of guidance in the ILO's health and safety instruments about good practice. So the duty of care clearly is foremost in everybody's mind, but basically we knew what the types of preventive measures needed to be as we learned more about the virus. And then the vaccines came along, thank goodness. Suddenly we had the prospect of vaccination. It felt like a dramatic step forward in fighting the pandemic, and so it has been. But for us in the world of work, it's posed a whole series of new questions about how to manage the world of work and vaccinations. And because we're short of time, let me go just straight to two or three of the key questions that we've had to confront and which are being confronted around the world of work. So the first one, and I'm not going to go on about it very long because it's been already very eloquently spoken of, we have this situation of inequity in the distribution of vaccines and access to vaccines. And I think everything that we think about in terms of vaccines at work has to be predicated upon the necessity of establishing a situation of universal access to vaccines. If we don't do that, anything that we do runs a risk of being discriminatory in the sense that there will be some sections of the workforce, not by their choice, but simply by the lack of availability of vaccines, who would be discriminated against by any measure that required vaccination in any given setting. So vaccine equity, universal access is world of work business. It truly is part of our business. That was reflected in the global call to action adopted by our conference last June. And then we come to the really difficult issues that we're all struggling with, let's be honest. First one, of course, is it's a $64 million question, is about mandatory vaccination. And it will be interesting to hear from Soumya how the WHO sees this. The fact of the matter is, whatever position we may individually have, we are faced with an extraordinary diversity of situations around the world. In most countries, there is no government policy, no legislation, no decree requiring mandatory vaccination as a condition of being in the workplace or carrying out one's duties. But they exist. Those situations exist. So we know the situation in France, where today some 3,000 health and care workers have their contracts suspended because they refuse to be vaccinated and they're unpaid. We have a situation where in Italy, in the middle of this month, we're in October now, we will have a situation mid-month in which a vaccination certification will be required to be in a workplace, or else a test, a negative test. So that's the first question. What do we think about mandatory vaccinations and accompanying conditions around such things? A second question, I was going to say secondary, but it's probably equally important, is about disclosure of one's vaccination status. Is an employer entitled to require that an employee or a worker on their premises disclose vaccination status, or is this a matter of medical confidentiality with a worker entitled to decline to disclose that status? If that's the case, how do you manage that type of uncertainty in the workplace? What type of distinctions can one make between those who declare that they've been vaccinated and those who either have not been vaccinated or refuse to share that status? Those are key questions facing governments around the world. It's not just governments, however, who are faced with these types of dilemma. It's companies as well. And what are we seeing? Well, again, we're seeing a variety of reactions by companies. I mean, the classic case of United Airlines, which is now telling its 500 unvaccinated staff that they're going to lose their jobs, effectively, because they choose not to be vaccinated. Other companies are taking a radically different position on that. Swiss Airlines are taking a slightly different position on all of this. And by extension, we see some companies saying the return to the office, the physical return to the office, needs to be predicated upon having a vaccination. That's not about one's status as an employee, it's about where and how one works. So we have an accumulation of these types of issues. Now here's the bad news, here's the confession from the ILO. Despite the fact that our organization came into being in the midst of a global pandemic in 1919, over the last 100 years or so, we really haven't been bothered very much by the prospect of pandemics and what types of workplace practices would be appropriate in the event of a pandemic. Our standards contain what I might call framing guidance around these issues. And Soumya has already mentioned some of the things that we encourage: dialogue, precautionary measures, employers and trade unions encouraging people to get vaccinated, providing objective information. But when it comes to the hard dilemmas that I've just referred to, there's a bit of a gap in our normative guidance. We simply do not have it. So, you know, if an Italian or a French health worker goes to a court nationally, whatever that court comes up with, I am not at all certain how an international labour standard might be adduced in support of either the action of a government or the complaint of a worker. It's not at all clear. So we're in that situation. and Roberto, as you're aware, I am talking to the leaders of our different groups, because I really think that the ILO needs to equip itself through a formal tripartite dialogue, not just by improvisation by people like me, but a dialogue between governments, employers and workers' representatives to see how far we can get in establishing some common thinking around how we deal with these issues. They may not be susceptible to a single global response, but I do think that dialogue has to take place, and frankly, the sooner the better. I'll just add one more piece and then I'll stop, Roberto. There's a particular worry, and we're getting this from your colleagues in the different sectors of the transport industry, from the maritime sector, from road haulage, from aviation. They find, and we're living in a moment when supply chains are in some difficulty in many cases, they find that international traffic is badly impeded, be it road or sea or air traffic, by the failure of governments to cooperate effectively in harmonizing vaccination certification and frontier formalities, so that truck drivers don't have to wait for a week at frontiers, as is happening today, where hundreds of thousands of maritime workers aren't stuck at sea or in port, unable to do their work, and where indeed even aviation staff find themselves subject to extremely difficult circumstances. So I throw that into the mix of perhaps some of the areas where we need to progress together. Thanks, Roberto.
Well, thank you very much, Guy. I think that you have highlighted the three areas. One is the access to, I wouldn't say just vaccination, because at the end of the day, and we have heard also Dr. Tumia also referring to the new progress made also in medicines, but to prevention and access also to I mean, if we do not realize that this is a global challenge, a real global challenge, and we just keep our nationalism approach, I think we will fail tremendously. But that's, okay, my opinion. I think that is something that has to be shared by all of us. The second area is, of course, the mandatory, and I have, from you, if I have something clear out of what you have said, Guy, is that there is not clarity, and also the instruments that we have right now are not fit for purpose. Perhaps we can have some elements, but at the end of the day, we need a proper discussion. The challenge, perhaps, is how to do it quickly, not improvising. That's also, and we are. I mean, we are not very known for being quickly in the ILO, and it's also a mea culpa, if I can say. But we need to act quickly, also to be able to be up to the expectations, but also providing with some accuracy. And then the third element related to mobility and the lack of coordination is equally relevant. Just let me. We are running out of time, but I would like just very briefly, Dr. Somia, if you can refer to the mandatory vaccination, non-mandatory vaccination. Feel free also to say what you want to say. I don't want to force you also. But I know that the approach of WHO has been very, very cautious on that. And perhaps I'm wrong. If you just can provide us some inputs on that.
Yes, sure. So maybe I can just say a little bit about mandatory vaccination. And this is clearly something which has it's not black and white. And so what we did was we had set up a working group on bioethics at the beginning of the pandemic. And this group has really been very active during the last 21 months and has considered a number of issues that have come up. And one of the issues that they discussed was mandatory vaccination, ethical considerations and caveats. And this document was put on our website in April of 21. And essentially what it does is it lays out a framework for how policymakers might want to think about mandatory vaccination and what would be the elements to consider, because clearly here is a situation where you have a common good, a good for the community, for public, and then you have individual liberty. These are the two extreme that one has to balance. And you need to know a little bit about the safety of vaccines before you make it mandatory. You have to look at the efficacy of the vaccines that are available, at the access and availability, as Mr. Ryder was just mentioning, if vaccines are not available and they're not free for people, governments cannot make them mandatory. and employers cannot. And then you need to look at proportionality of making something mandatory and the risk of not being vaccinated poses to the individual. And therefore, you cannot consider all workplaces to be the same. A healthcare worker is at a very different level of risk than a person who's working in an environment without much of interaction with the public, or where there is not much of crowding and so on. Person who's living in a dormitory or working in a factory where there a lot of crowding and poor ventilation may be at a very different risk than somebody who's remote working. So there are many aspects to be considered. Schools, what about educational institutions? Mandating vaccines for the public at large would be, I think, well, it would be unrealistic. I doubt if anyone would do that. But certainly some countries have mandated vaccines for certain groups of people. So I think this framework actually allows us to think about this complex topic in a way in which decision-making can be based, on the considerations that need to be taken into account. And of course, as we are learning more about vaccines, we're also recognizing that while safety, luckily for us, has not been an issue with most of the vaccines, the efficacy varies, the duration of protection varies, the variants come on. And so you need to do, again, vaccines plus masking. So a dialogue, the downside of making anything mandatory, of course, is that then the public starts losing confidence. And if there's already an issue of trust, then that gets further eroded. And particularly people who've been traditionally marginalized are the ones who are likely to be most distrustful of any such mandates. So we'd be very happy to engage in this discussion further. I think it is a topic which has broader implications and repercussions beyond COVID and perhaps in preparation for the next. It could also help us to think about influenza and how we handle that year after year.
I think it's very helpful. I would just highlight the last element that you pointed out, the trust element. I mean, how you build trust. Not just at the workplace, but also with individuals. And I want to thank both of you, Guy and Dr. Sumi, also for joining us, because that brings us also to the next intervention. And we have the social partners, and we have employers organizations. Peter Robinson is the president of USAID, our American member, very active, very engaged in the IOE. But I also have to say that he was among the first ones who addressed me already when the pandemic, I would say, was starting, on an initiative we had to do also with persuading individuals to vaccinate. And at that moment, I was, frankly speaking, personally, I was a little bit surprised by the initiative when I heard I would do it, because I thought that at that moment, we were not even having the vaccines. And the first thought that some people have is that once the vaccines are there, that will be, to some extent, welcome by everybody. But the situation is much more complex. And in a country like the USA, where the respect for individual choices is very strong, and also the respect for privacy and confidentiality is also very strong. I mean, having an organization like USAID also very much engaged on an initiative which I think is quite relevant, and which, by the way, I also joined, also with some caveats, also I have to say. I think it was relevant. And we want, Peter, you to bring us also this experience, but for that also we have Susan Hogwood, who is the president of the Educational International. And thank you, Susan, because it's very late for you, you're in Australia. And the educational sector, I mean, is one of the most effective, but precisely all these measures on, not just on prevention, but specifically on vaccines, not vaccine, is especially relevant and tricky to deal with also from the workers' perspective, the trade union perspective. So I would like both of you to give us an insight on how you're dealing with that on your national capacity, and also, Peter, on your global capacity, because you're very also active in IOE, before we move forward, and also from the international and trade union perspective, because it's very important also that we go together with the workers. Okay? So Peter, you have the floor.
Well, thanks very much, Roberto, for including me, and I really appreciate hearing the views of Sumya and Guy on facts and dilemmas that we face. I think it goes without saying that employers feel an urgent need to get back to work and reboot our economies, but it's going to take all social partners working together to ensure that we do that in as quick and safe and responsible a way as possible. So I fully support, for one, Guy's suggestion on tripartite dialogue. As an employer representative, I can say the defining moment came for me about a year ago when the Edelman Trust Barometer revealed that employers, not big business, but employers in general, were felt by employees to be one of the most trusted messengers of information on COVID response. And so it was then that I and we as employers realized that we not only have a special role to play, but a real responsibility in vaccine literacy and COVID response and rebuilding. And we've been stepping up with action and programs, but I will get into our business partners to convince in a bit, but I thought it might be helpful to hear a little bit about what's happening in my home country as well. Globally, nearly 3 out of 4 people say they're willing to take the COVID vaccine, but we have yet to reach that goal in the US and still have a long way to go globally. Regrettably in the US, recent data actually shows a drop in the willingness to be vaccinated over the past year compared to an increase in many other countries. A year ago, 3 out of 4 Americans were willing to be vaccinated. That's now dropped to 2 out of 3. And we can also see what an interesting phenomenon that could be interpreted to be a political impact on messaging, because we've got a divide between blue states like California and those in the Northeast, like, my state, Connecticut, New Jersey, New York, Maine, Massachusetts, et cetera, where the unvaccinated rate is around 30%. And red states like Wyoming, Idaho, Montana, Alabama, Florida, where the unvaccinated rate is around 60%. So there's a huge difference there. So ironically, in a world where many people are waiting impatiently for delivery of and access to vaccines that they are eager to take but don't have yet, in the US, we have a situation where the refusal or hesitancy to be vaccinated with available vaccines has kind of slowed us down on the road to recovery. So I think that goes back to the importance of messaging and the responsibility of employers to get out there in front on that. And we've also seen, as Guy mentioned, employers beginning to take matters into their own hands, like United Airlines, which just laid off several hundred staff who refused to be vaccinated by their compliance deadline. But on the other side of the equation, 99% of United's employees now have received at least one shot. And another recent case is Tyson Foods. Back in August, they put in a vaccine requirement at a time when only half of their employees were vaccinated. Now 91% of their employees are vaccinated. And as you may have heard, in the US, President Biden recently announced a vaccine requirement for companies of 100 or more workers. So there will be new Occupational Safety and Health Administration, or OSHA, rules requiring them to ensure workers are vaccinated or tested weekly for COVID-19. I think generally, while there have been fears of a mass exodus of people quitting and not returning to work, preliminary results show that people are following suit, trusting their employer and government and getting vaccinated and returning to work to protect health and safety and liberty. And following up on the comment by Sumya before, we've seen recent surveys showing that the public generally supports employers who are working to protect society by requiring vaccination as a condition of entry to work, such as United and Tyson Foods. And this is in sync with global efforts supporting governments to provide equitable vaccination access so that no one gets left behind. Roberto mentioned a specific program that we've been involved in with IOE's support. Last year, the USCIB Foundation and USCIB, with the support of its global affiliates, including IOE, established something called Business Partners to Convince, or BP2C, which is an initiative designed to encourage and support employers worldwide in making the case for vaccination once vaccines are available, and to counter misinformation and hesitancy. We've been joined by a number of international and national employer organizations and now have a coalition of about 25 business networks, and have received some significant financial support from leading global companies in our membership. And I'd like to take the opportunity to express special thanks for the support of IOE, whose role is and will be especially critical given its extensive range of employer organization members, particularly as vaccines become more available in developing countries. To build momentum for a global movement among companies, both large and small, to take up the challenge society faces from a global pandemic, BP2C launched the Global COVID-19 Workplace Challenge, which asks employers to publicly commit to the following 6 actions. 1, listen to my employer's needs and concerns about the impact and prevention of COVID-19. 2, follow the latest public health guidance to protect myself, my employees, my workplace, my customers, and my community from COVID-19. 3, promote vaccine literacy based on the latest scientific evidence of vaccine benefits and risks. 4th, encourage vaccine confidence and uptake. 5th, advocate for accessible, equitable, and timely vaccination of employees. And lastly, engage with communities, schools, faith-based organizations, and public health leaders to stop the spread of COVID-19. The challenge is supported by the BP2C website, where employers can access fact-based information, case studies, toolkits, social media messaging, and videos to help build out strategies to counter misinformation and promote vaccine literacy among their workforces. And obviously, we realize that the message about confidence and convincing is really only applicable once there is vaccine availability, but we hope that that will be taking a greater hold as soon as possible everywhere. So looking ahead as the debate on credentials, passports, verification schemes, and other ideas advance, we continue to support efforts to strategically engage business and government bodies to effectively communicate to build vaccine confidence and help galvanize support for renormalizing a COVID-protected world. We're hoping for a robust recovery in 22, but if we don't work together to advance vaccine access, literacy, and uptake globally, we could face barriers for building back better. But I remain convinced we can find a way with business employers and the private sector helping to forge the way forward with our efforts such as this event, but in collaboration with our social partners. Thanks, and be willing to answer any other questions on this initiative we've done. Thanks.
Thank you so much, Peter. I think many of the data that you shared with us at the very beginning of your intervention are quite significant in terms of how we can approach such a complex issue. And also, again, thank you for your engagement and commitment with us. By the way, we have also some comments. And one of them is from Chris Demester, who is one of our best leading positions in IOE on health and safety, and precisely referring to why we should not have a mandatory vaccination, with some good arguments, I have to say. But before that, we come in, then I would like to go to Susan Hopwood again. 1.2 billion students in 2020 and 2021 are affected by the pandemic, and then the coming back to the premises of the educational facilities is really tricky. So what are the kind of insights from a trade union movement that you can provide us in terms of collaboration also with employers and also with the International Labour Organization, World Health Organization? How can we act together efficiently in this area? Mute myself, so you have to unmute yourself, Susan. Yes, unmute yourself. We cannot hear you.
No, I'm trying. Yes, it's worked now. Look, thanks very much, Roberto, and particularly for this invitation, which is very timely. The discussion is very interesting and just as applicable to education and teachers and our students and education workers. But I just want to start by saying that it's particularly timely because today is actually World Teachers' Day, and we're marking this obviously with the ILO, UNESCO, and UNICEF, who are our co-conveners, actually just focusing on actually the lives we've lost over the teachers and educators' lives we've lost during the pandemic. The numbers are staggering. The stories of human toll this pandemic has had on our students and our communities and our educators seldom actually gets covered. When the significance of this particular moment is not lost on us either, for a global profession, such staggering losses anywhere is felt by all of us everywhere. The fact that the vast majority of those we have lost never had the opportunity to be vaccinated only reinforces, our commitment to ensure vaccine equity and safe working conditions for those who continue to work on the front lines with populations who are least likely to be vaccinated, and that is children. For yet another year, educators obviously have been adapting and improvising at the classroom and community level, working through their unions to forge and direct policies at systems level, and also, of course, at the same time managing the personal challenges unique to so many frontline workers. And any of you who are parents and who've had their children not in school but at home undertaking remote learning will understand those issues. Because the absence of in-person schooling in the pandemic has created a void and delivered a very unmistakable lesson in every community about the importance of teaching a place called school and the necessary structures and systems of education. And this is driven home to us by the maths of inequity. Effective remote learning is impossible when one half of the world has no internet. The loss of school-based nutrition adds to the historic and rising rate of global hunger. 11 million girls so far during COVID-19 have joined the already existing 130 million girls out of school, and they may never return. And as Guy Ryder can tell you, 9 million more children will likely join the ranks of the 152 million child labourers by the end of 2022. And these are big numbers, staggering and difficult to comprehend, but they start with such small numbers, like 1 or 2 jabs in the arm of a single person. And that's why, from our point of view, the TRIPS waiver is so critical at this moment. COVID-19 vaccines and treatments are truly global public goods. Lives are at stake. The lives of our colleagues, their communities, and their students' right to a future. One last study last month says more than half the world will be susceptible to the virus at the end of this year, with significant transmission spread into 2022. So together with over 100 countries and countless organisations, including the WTO's own director, Education International believes that the most effective solution now is to temporarily waive intellectual property barriers on COVID-19 vaccines and medical products. While we make significant strides by convincing a few opposing governments, including my own, Australia, we, all stakeholders in the world of work, workers and employers, must keep up pressure on the remaining ones in the EU, the UK and Switzerland that continue to block what we know is a stepping stone in moving towards an equitable and effective global recovery. As teachers, we're a presence in every community and by extension, the economy in this time of COVID-19. We know there's no end to this crisis, no fully safe return to schools or commerce or true community without vaccine equity worldwide. Others have spoken about this today, but as long as the vaccine access falls short of meeting the global demand, we will continue to see strengthening subcurrents of the pandemic pull us further out to sea, further from the shore of recovery. More than a year ago, almost overnight, the world experienced prolonged school closures and the transitioning of more than 90% of the global student population to off-site emergency education. And no education system was fully prepared for this. But millions of teachers and education support personnel adapted to emergency distance practice. Teachers took the lead to keep education going for millions of students, even though most didn't have the tools or the training. Because we know that individuals make a difference in our time. Those on the front line, those in constant harm's way who deserve our thanks and praise. But if we aim to move from the past into the future, it won't be the work of superheroes. It will be hard won by the collaborative work to build, operate and maintain systems, especially a public sector that has been dismantled and distorted in many nations by politics, neglect and now pandemic. We know in the education sector that countries where government and employers have meaningfully engaged with unions, they've fared much better in the pandemic than countries where educators and their unions were not involved or treated like obstacles. And we've taken this as a sustainable template for recovery across all sectors. We've adapted that as a commitment. With the OECD, we established 10 principles for equitable and effective educational recovery. And I'll just take a couple of minutes to run through them. 1, keep schools open as much and as safely as possible. 2, ensure equity and align resources with needs. 3, provide a remote learning infrastructure which is designed to teach all students. 4, support teachers in their professional lives. 5, enable teachers and parents to support learners. 6, provide targeted support to meet students' learning and social emotional needs. 7, co-design a robust digital learning infrastructure with teachers and stakeholders. 8, empower teachers to exercise their professionalism and benefit from professional learning opportunities. 9, encourage a collaborative culture and innovation. And finally, learn from national and international evidence. And I hope that's self-evident to this organisation. Colleagues and friends, we know that equitable recovery and sustainability and quality education and every other aspect of civil society is impossible if we continue to defund and monetise the public sector, ignore the climate crisis, allow Pandora paper tax havens to cloak themselves in darkness, and if fail to confront growing threats to democracy. So on this World Teachers' Day, if I can remind you again, teachers and all education workers are standing with our troubled and anxious communities. Our partisanship is no secret. We stand for truth, and through our unions, we take collective action in the face of lies and disinformation. We educate, inform, and work to activate citizens against intolerance and authoritarians. And we are mobilised to make sure that the post-pandemic future is built upon listening, teaching, and collaborating on the work necessary for an effective and equitable recovery. Because after all, the future depends on it. Thank you.
Thank you very much, Susan. I think that the 10 principles you refer to are guidance that many of us could also take with us also for the future. It's not just trade unions principles, and also you refer to collective action. I think this collective action is not just trade union collective action, it's also collective action for all of us, especially on disinformation. We have to be much more accurate. And that's why, I mean, all the ingredients that we have of information provided by WHO also, I think Guy also has provided out some insights which are useful, the experience Peter referred to, and also your take and also your experience, and also help us the way forward. I know that the tricky question is tricky, of vaccination mandatory, and how the trade union movement, and if you could also try to answer that. And I don't want to force you on this, but I think it's difficult conversations that we need to have. And we have already have some exchange in the chat box. By the way, there is one colleague from Trinidad and Tobago that also raised the point. Yes, I agree. There is no possibility of making mandatory vaccination, even in some sectors. It's very, very difficult. But what else the employer can do? I mean, because it's very, very difficult. That's what one colleague has already sent as a message to me directly that I'm sharing with all of you. And if you can help us, Susan, that would be helpful also for.
Well, Roberto, look, I live in Australia, and in fact, I live in Melbourne, and we've just actually had the dubious honour of being the most locked down city in the world. And we're facing exactly these issues here right now. We were one of those countries that Sumia referred to before, did well last year, have been hit by the Delta variant at a time when we were under-vaccinated, absolutely under-vaccinated. And so now there's the great rush for vaccinations so that we can actually get the variant, the infections under control. Now, that of course raises the issues of mandatory vaccinations. And from an EI point of view, trade unions in Australia, if I could say from trade unions in Australia, but I think this view would be held by many right across the globe. The important thing is for governments to, we've always said this, governments must follow the science and the health advice. That's the critical thing. They're the experts, and they're the ones telling us what we need to do to actually fight the pandemic and actually get on with our lives. And so, you know, the view that we're taking, we actually have had two of our two largest states in Australia. The governments have announced mandatory vaccinations for all those who work within schools and early childhood settings. Right across, the teachers, for example, must be vaccinated, have received at least one vaccination in the next month or so. Our schools are mostly closed in those two states, and state schools are opening, and they want it. Now, you know, from our point of view, they are doing that on the advice of the health officers. They're doing it through a health order, and therefore we say to our members, look, you have to follow the health advice. If that's what we think is going to make schools safe, that is one of the important things that we must do. Now, there's lots of opposition to that, let me tell you. In the same way as people have been talking, you know, and governments in Australia, the federal government has declined to make any declarations about mandatory vaccinations, much to, I think, the chagrin of employers, actually, and business, because it's sort of like leaving it to them. Whereas state governments have stepped in and said, in relation to many industries, we will introduce mandatory vaccinations. So it is difficult, but I think that, you know, the issues that have been raised are very important about, you know, there is the risk of mandatory vaccinations actually causing more people to be determined not to be vaccinated. Actually, the vaccine hesitancy rises, although interestingly, we're not finding that. And I think that, you know, we're fast heading in those two states to 80% of the 16 and over population being double vaccinated. So look, I think that, you know, just in summing up, I would say that we've always taken the view that it is about the health and it is about the science, and that if we stick to that, if governments stick to that, and they provide the advice, you know, it does go back to the WHO 3 steps that Sumia spoke to before. Assessing the risk. What is the risk? We think the risk is very, very high in schools. We know that. And we know there are a lot of things that can be done, like ventilation and so on. But also, because children in particular cannot be vaccinated, one of the ways that we can keep it safer for them is to actually vaccinate the population, the adult population around them. It's difficult. It really is. But in some ways, I think those WHO sort of guidelines, you know, make a lot of sense, because they give a framework for proper decisions to be made, and therefore people can feel more confident. Actually, workers can feel more confident that the decisions have been made for the right reasons, and that is for our health reasons, and also to get our economies back, to get our schools running, and to actually lead to some normality in our lives.
Thank you so much. I think it's very interesting. I mean, it's very interesting the approach you have taken in a very, very difficult context. At the end of the day, I mean, it's wise also to follow the health guidance, and to some extent but I understand it's tricky. And for this reason, we have now I don't know whether I'm very, very, very good optimizing the time, but we have 3 important contributions that can be of help to all of us. First of all, we have a good legal expert of a partner company of IOE, who's going to provide us some insights on I would say, outside on how things are developing precisely on vaccination, prevention, and legal framework in some countries of the world. I think that can be very, very helpful. Before we go to a much more, I would say, workplace company level with an employee organization for a developing economy, which has also some issues relating to prevention and also other kind of remedies, and also a company here in Switzerland. I say here because I'm in Geneva. So Tom, thank you very much for joining us, and we would like to have also your guidance, and also more than guidance, your explanation on how things are developed in specific jurisdictions, in specific constituencies, and how also we can see any trend, if any, regarding legal certainty on this area. Thank you very much.
Thank you very much, Roberto, and good afternoon, everybody. I think Elodie is sharing some slides. I'm conscious of time. I won't share all of my slides, but you will have them to take away afterwards with a bit more detail. And the session, as Roberto has mentioned, is on the global legal aspects of vaccination. This is a very, very high-level summary, focusing on Europe, Asia-Pac, US, basically. So some of the material I'm going to talk about has been touched upon in some of the previous discussions, but I'm hoping we can draw the legal framework together as a result of what I'm going to talk about. So, Elodie, we can move to the next slide, please. So this is a very, as you know, a very incredibly complex and politically sensitive issue. Peter referred to this as it works in the US, and I'm going to touch upon that in a moment. There are some obvious differences in approach in different jurisdictions, and that is changing daily, as evidenced by United Airlines news last week, what's happening in France today. It's a very difficult issue to keep up with. And I think the focus is on three main legal areas, one of which is health and safety law, then it's local labour law and data privacy law, all bound up with the politics of vaccination and take-up rates in particular jurisdictions. And that's got a clear impact on the risks that employers and national governments are willing to take on these issues. Turning to the next slide then, please, Elodie. So the first area I'm going to talk about is in relation to health and safety. More generally, there are employee duties and employer duties in respect of employee vaccination. Turning to Europe firstly, apart from the very recent and well-publicised example of Italy, the position in Europe is generally it's unlikely that local governments will legislate to incorporate mandatory vaccination into the workplace, and they will leave that to individual employers and pass the risk on to them. The one sort of exception to that is Italy, where you'll all be aware that from the 15th of October, Italian employees must access, to access the workplace, must produce a green pass, which effectively is evidence of completed vaccination or in other jurisdictions, the approach is very much focused on a sectoral basis. Sectors, one example being in the UK in respect of care homes from 11th of November, it will be a requirement for employees to be vaccinated. Worth bearing in mind that there is actually a legal challenge going to the UK courts in respect of that. We've heard about France in relation to legislation for coming into contact with vulnerable people, and the aviation sector is also seeing some particular sector approach in different jurisdictions. So turning to the US on the next slide, please, Elodie. So the US and South America, I'll take the US first. As you'd expect in the US, federal state governments not at all keen to mandate vaccination apart from in particular circumstances. It's a very partisan issue there, but possibly because of those lower take-up rates that Peter referred to earlier, there is more leeway given to individual employees to mandate vaccination, and the Occupational Safety and Health Administration guidance is supporting those efforts. There are still disability and religious limitations, which I'll touch upon in a moment. The key issue in the US, I think, is probably safe to say is politics as much as anything else. Similarly, in South America, it currently seems unlikely local governments will legislate to incorporate mandatory vaccination. The focus again is on encouraging vaccination. There are some different approaches, however. For example, in Brazil, the Supreme Court recently granted some permission for local authorities to introduce measures for compulsory vaccination, but it's not quite translated itself into actual legislative legislation on the case law book as it stands. Mexico, for example, I suspect will take a different approach, and that will be seen, we feel, to be a violation of the individual constitutional rights to self-determination and physical integrity. So there could be some movement in relation to that, but not at the moment. Turning to the next slide in relation to Asia. Again, in most jurisdictions, not generally seeing mandatory vaccination. Some sectors are focusing on it. China, Hong Kong, India, taking the view that certain employers may be able to justify it in particular circumstances if there's a compelling health and safety reason to do so, but the government will not be getting involved at this point. Japan and South Korea, very, very adverse to it, would see that to be a violation of the individual's right to self-determination and physical integrity. In Asia, however, some slightly different approaches. Indonesia has now recently introduced the vaccine being required for all unless an exemption applies. Singapore, employees in selected sectors being required to be vaccinated, and in Malaysia, it's been recently introduced as being compulsory to be vaccinated to work in a government post. Turning to the next slide, please, Elodie. The issue of privacy, clearly absolutely hugely important. Vaccine status very evidently will be personal health data, and as a result, likely to be a significant practical barrier to employees knowing if or when their staff have actually been immunised or not. The position varies across different jurisdictions. Turning to Europe on the next slide, please, Elodie. You'll all be very aware of the GDPR regime, and obviously vaccination status information will be special category personal data under GDPR, which will make it difficult to request and process that information lawfully without having a lawful reason for doing so. If ultimately it's not necessary to collect the data, it will be unlawful. It's probably seen to be not necessary at this stage because in the majority of cases, government guidances that health and safety measures are required irrespective of vaccination status, and evidence demonstrating the transmissibility of the Delta variant is not actually reduced by vaccination itself, albeit it will reduce the severity of the illness. To that end, a lawful basis is required. Worth pointing out that consent on its own is rarely appropriate in an employment setting, given the imbalance of power between the employer and the employee. So consent may not seem to be freely given in the circumstances. Anonymous data is easier, but anonymous data and visual checks, which have been introduced in the UK in some employers, for example, they can be very effective in tracking overall rates of vaccination in the workplace, but not in terms of working out which of your employees has been vaccinated and when. Turning to South America then, the next slide. Again, there are data privacy laws applying in most of LATAM, which would extend to vaccination status information. So a similar picture to Europe in one respect, albeit in general terms, consent is more widely used. And while there are strict rules in relation to how that consent is provided and safeguards involved, particularly in relation to data security, in most jurisdictions, the ability to give consent does free up the ability for employers to ask for the information, albeit there are certain jurisdictions where a stricter approach is taken. Turning on to the next slide, in relation to the position in the US for data privacy, a more liberal regime in the US, and there are specific exemptions from certain legal obligations and legislation. And in general terms, as long as confidentiality and proportionality are respected, you can generally ask your employees to provide information on their vaccination status. Next slide, please, Elodie. In relation to Asia, position there, again, fairly similar to what I was talking about earlier in relation to the use of consent. So in respect to South America, in most circumstances, there are generally data privacy laws in jurisdictions such as China, Hong Kong, India, Japan, and Singapore, which rely on a lawful reason being required to collect that data. Consent can be part of that picture, which can help in certain circumstances. There are certain outlying jurisdictions such as Indonesia and the UAE, for example, however, where there are no particular privacy restrictions. Whether that will lead to increased requests for vaccination status data remains to be seen. So in relation to the next slide, please, turning on to the employment law position, you'll all be aware of the key issues to bear in mind when it comes to whether you can ask employees to be vaccinated and ask them to give that information. Discrimination protection is broadly in place across most jurisdictions, although the extent of that varies. Will that requirement be a lawful and reasonable request, which could justify disciplinary action if not complied with? Pay, what happens if somebody refuses to turn up to work? Should you pay them? Should you pay them to go and get vaccinated? Consultation obligations, particularly in Europe, where you have well-developed collective consultation mechanisms, co-determination, works councils are a key part of the picture. And then finally, national laws on unfair, unlawful, and wrongful dismissal. Turning to Europe on the next slide then, please. As you'll be aware, member states in the EU and the wider EEA have discrimination laws. Protected characteristics differ by jurisdiction. The key ones, though, are likely to be pregnancy-related, potential discrimination, religion or belief, and disability. Some jurisdictions are starting to go further. For example, Romania, where the local parliament is discussing a new ground of discrimination based on the administration or not of any vaccine. You then focus on whether there is potential unfair treatment under national law, pay protection, as I mentioned earlier, and particularly in the European sphere, consultation obligations, collective engagement with trade unions and works council, absolutely key in the circumstances. Next slide then, please, on to South America. Again, many discrimination protections in national jurisdictions. Again, pregnancy, religion or belief, disability, the key ones. The law, it varies across those different jurisdictions, and enforcement also varies in terms of discrimination rights, but the same issues apply. Also call out Mexico in relation to unfair termination and discrimination. The current suggestion is that proceeding with a dismissal decision, for example, in Mexico could be extremely risky in the particular circumstances, and unless the law is changed in the foreseeable future, that would make things extremely difficult and fraught with risk. Turning back to the US then, so we can just go back to the next slide. Thank you, Elodie. Position in the US, obviously the employment at will approach means there is wider scope for employers to demand particular action from workers, including in respect of vaccination. Discrimination, however, it should be taken into account, particularly in relation to disability and religion. The key issue in the US, however, is more of a political one, I think, and Peter touched upon this. In certain, let's call them red states, who typically would vote Republican in the US presidential election, these states are starting to propose legislation to effectively enshrine protection against discrimination purely based on vaccination status, not even indirectly related to disability or pregnancy. So just to name a few: Alabama, Kansas, Oklahoma, South Carolina, Tennessee, Indiana, and Kentucky all are introducing bills to prevent employers from taking adverse action against employees who choose not to be vaccinated. Turning to the next slide, please, in relation to Asia. Again, in relation to discrimination, general protection against discrimination applies throughout most of Asia, although it's probably fair to say the scope of protection is narrower than it is in Europe, and in practice, actual enforcement to the courts is rare. But the risks are still there. You still have potential for claim, basically in relation to general discrimination, general unfair treatment, particular characteristics in relation to disability, religion, belief. So the usual issues which we've been focusing on, that is the position across all the large Asian countries. China, Hong Kong, India, Japan, all have similar legislation in respect of that. Singapore, no particular discrimination laws. However, there is the right not to be unfairly dismissed. And what we're seeing is a pattern of challenge in the workplace at the moment, which will inevitably lead to local labour disputes, case law, at which point we'll start to see a picture of how different national governments and national courts are dealing with the challenge of enforced or not enforced vaccination in the workplace. Thank you very much.
It has been really very detailed and very rich input on different regulations. At the same time that you were speaking, we have a very intensive exchange in the chat function to tell you. One has to do with those workplaces in which you can have a risk assessment, which recommend vaccination of most of the workforce. Even though there is some reaction to that, saying that it's very difficult to have risk assessment, strongly recommending most workers or the big majority of workers to get vaccinated. And then there was also, if I remember it well, there was also our Dr. Otsumi again referring to the, that's another thing perhaps different, to the vaccine passport and how the WHO is facing that, and if I understood it correctly, it's not recommending it because of the lack, first of all, of coordination, and also the lack of access also to vaccination among different countries. Then there were also some comments in the chat function related to the Convince initiative, and I saw also Scott referring to that, but also many questions because we have the executive director of the Honduras employer saying, in my country, I have the legal obligation to secure shared health and safety, even linked to a crime, typology. But at the same time, I cannot, disclose some information. So that raised me a point which I would like to ask you, and it's, you refer, yes, to mandatory, non-mandatory discrimination, which is an aspect that we have not been discussing by now, but also is the confidentiality of health data, which is very protected in many jurisdictions. And now we see a situation in which of course, you have to respect the regulation, but to some extent, if there is any pressure on this side, it's difficult to tackle it, not having access to this information. So it's also a tricky element, how I can really assure, following the guidance of a government, a health and safety environment at the same time that they have to respect, and they have the duty to respect, not just the non-discrimination law, but also the confidential data of my employees. Is there any answer you can give us? I don't want to force you to answer, just if you can.
Sure, it's fiendishly difficult because of the different variations in approach, although there are some key themes, as I mentioned. What was interesting in relation to testing, I remember at the start of the pandemic, there was many of these concerns in relation to testing. The position has changed, I think, politically, and then society has got used to testing, and there have been more serious steps and radical steps in relation to testing. But I think the issue with vaccination is it's so heavily politicized. I do query whether that's likely to happen with vaccination. I think the answer to that is probably no, would be my guess. And as a result, it is going to lead inevitably to employers being required to take these decisions on a case-by-case basis. And if they have a justification for asking people to be vaccinated in particular sectors where they feel there's a compelling need, comparing the rights of the individual as compared to public safety effectively and health and safety of customers and other employees, then they will take that decision and do it. Employers who take knee-jerk reactions and take decisions without that justification are going to be in quite a lot of serious difficulty in relation to potential claims, whatever jurisdiction they're in, whether that relates to individual claims or collective pressure and general leverage in other respects. So I think that the short answer is legally, it's a risk assessment. If you are in a sector where not having people vaccinated is causing a potential serious risk to other people's health and safety, I can understand you're likely to take the plunge, as it were. If not, then there are likely to be a very long tail of potential claims arising out of the situation.
Yeah, I thank you very much, Tom. Again, I think your main answer has to do with caution in the way you deal with this pressure, case by case, but also carefully, assessing also from a legal perspective what the consequence could be of forcing someone or putting pressure on an individual on this area.
Yeah,
but,
I mean, I am a lawyer, obviously, so caution is my buzzword, but it's all about justification, and in a particular example, thinking, well, do we have enough information, enough justification if challenged to say, well, we absolutely needed to ask people to be vaccinated in the workplace. Without that, it's a very difficult situation to face, and I'd love to provide answers, but it's still very early days because the legal claims are not quite coming through yet.
And you will never get all this. I mean, it's very difficult to have this assessment, and it's absolutely necessary to have that. Thank you very much again. Now, let me go to two interventions which are also very, very relevant. One has to do with our member in South Africa, a country which is quite significant in terms of developments in the pandemic, because on one side we see also quite an important culture at the workplace of employers acting responsibly, but also there is you normally think that in more emerging economies and developing countries, it'd be easier to get a path of vaccination, but that's not the case. I mean, there is also a strong need from the employer also to act wisely on this area. Martin Kingston is the chairperson of Business for South Africa, B4SA, and he's also linked to Busa, who is a member of IOE in the country. So, Martin, thank you again for joining us. We are more than willing to hear your experience and any practical guidance that you can provide us before we go also for the next speaker who has to do with the company level. Okay, the floor is yours, Martin.
Thank you very much, Roberto, and good afternoon, everybody. Thank you, Elodie, for the slides. I'll go through them as quickly as I can in the interest of time. If we go to the next slide, please. So the Business for South Africa platform is a virtual platform. It was established when COVID arrived in March 2020. We recruited resources on a pro bono full-time basis. At our peak last year, about 450 people working across 3 platforms. The healthcare platform, primarily focusing on bringing PPE into the country, modeling different infection scenarios and looking at lockdown restrictions, putting in place a long-term post-COVID economic recovery strategy, and then thirdly, a labour market platform to look at how we could put in place benefits, about 60 billion rand paid to over 6 million beneficiaries to date. As I said, we mobilized in March. We handed over and transitioned primarily to government, the National Department of Health, in December, and then we remobilized with the focus exclusively on the government-led vaccination program at the beginning of this year. And I think the story is one of social compacting, where we have to leverage across all social partners if we're going to be able to combat the pandemic and indeed roll out a vaccination program as effectively as possible. If we go to the next slide, please. One of the first things we did, I'm not going to dwell on this, but I think the headlines are important, is to put in place an economic recovery strategy. These slides can obviously be circulated afterwards. Our GDP contracted by 7% last year versus 3.5% globally as a consequence primarily of the pandemic. We anticipate it's going to take us 3 years to return to pre-COVID levels of real GDP. We lost about 1.6 million net jobs, 2 million at the peak. Our unemployment is now broad unemployment. Those who are capable of working is now at about 43% of the adult population. We think it's going to take us 10 years to get back to pre-COVID levels of employment. Even though we've revised our growth prospects up, it's going to require some very significant and courageous steps to be taken by government at a time when we're cycling through various lockdown levels. We've just come out of lockdown level 2. We've come out of the 3rd wave. We're anticipating the 4th wave to begin in about 2 months' time. Next slide, please, Elodie. I'm not going to dwell on this slide. We identified a whole host of interventions that needed to be put in place in parallel, interventions, enablers, and indeed structural reforms at a time when we were suffering one of the worst levels of both fatality and infection, not just in the continent, where certainly that's the case, but actually more broadly in the world. If we can go to the next slide, please. At the beginning of this year, as I say, we remobilized the platform, 5 work streams. These are synchronized with government. There's a joint committee chaired by the Director General of Health. I deputize for him, involving the Labour leadership, working with National Treasury and the Presidency, and focusing on 5 areas: the supply, allocation, and delivery of the vaccine, making sure we had adequate service delivery platforms, disseminating the requisite information and data to be able to manage the flow of the vaccines, underwriting the cost, and critically importantly, it's already been mentioned, of course, ensuring that we had alignment in terms of communication, advocacy, and stakeholder engagement. Probably the area where we have fallen down worst as a country, but in fact, I think it's been a universal experience. The next slide, please. If we look over the last year, the last 9 months, we can look at where, and dark blue is much better than light blue, by the way, we've made progress. We were very constrained in terms of vaccines to begin with. We now have effectively a surfeit of vaccines, J&J and Pfizer, certainly enough to vaccinate the entirety of the adult population. But it's worthwhile pointing out that at the moment, we're only 22% fully vaccinated, 32% partially vaccinated. Similarly, ramping up the delivery and the capacity to administer the vaccine, again, moving very quickly. We've now got more than enough capacity in the public and private sector, as I will show. But the most significant problem and the challenge that we found is we've been unable really to move the needle in terms of demand, and we haven't been able to achieve what we had set out to do, despite the fact we've both got the supply and the capacity to administer. If we go to the next slide, please. In terms of the private sector, as I said, we mobilized across the entirety of the private sector, in hospitals, non-traditional healthcare establishments, pharmacies, GP groups, workplace sites. And effectively, the private sector has about 50% of the capacity to administer the vaccine alongside the public sector, and it's done on a completely integrated basis. So we work hand in glove with NGOH in determining that whether people are insured or uninsured, employed or not employed, they can get vaccinated anywhere. It's either paid for by private medical insurance or it's reimbursed by the state. And we have ramped up quite quickly, as you can see in the next slide, from a relatively slow start. The light blue is public sector, the dark blue is private sector. We are now approximately 35% of the vaccinations in the private sector that is being administered. But as you can see from the narrative on the right, this is where our problem lies. So 9 million people have been fully vaccinated. That's 23% of our adult population. Some 13 million have received the first doses. That's some 32%. But we want to get to 28 million by the end of 2021, which means that we effectively need to almost double the rate of vaccination between what we have enjoyed to date and what we need to do by the middle of December, particularly acknowledging that we're probably going to see the 4th wave upon us, as I said, starting sometime in the middle of November. Next slide, please. What has been crucially important has been the role that employers can play, as I said, hand in glove, both with organized labor as well as with the government. And some of these issues have already been ventilated in this discussion. The first is making sure that there's access to information by way of education in all languages. In fact, in South Africa, we're now printing that information in 11 different languages, ensuring there's time off to vaccinate, making it as easy as possible by using, but not only using, workplace sites, and putting in place both positive and indeed negative incentives, including certification and only allowing access to either workplaces or events. That's what's being currently worked on, if we're able to demonstrate that there's appropriate certification. And we see mandates now as being a key lever to drive demand, probably the most significant lever that is in the South African armory. Despite the fact that the government has made it clear it's not going to impose mandates, it's equally acknowledged that the private sector, both sector by sector and indeed company by company, is going to start mandating, and that's effectively provided for already in our labour regulations, our OHS regulations that were put in place by the Department of Labour when the pandemic began. The most important things is that we maintain capacity of the vaccination sites, that we implement those regulations, risk-adjusted regulations for the workplace, and that we roll out the ability to be able to vaccinate not just the workforce, but families of the workforce and communities within which businesses are located. And we're seeing now a very high level of cross-sectoral cooperation. And most critically, that we need to have an all-of-society approach involving civil society, organized labor, business, and government working on a completely integrated basis if we're going to be able to drive demand adequately to be able to ensure that we can indeed vaccinate the vast majority of our adult population, at least with one vaccination this year. I'm not going to dwell on the next slide. It's just a set of examples that we can look at in terms of where we've been partnering with either local, provincial, or indeed national governments to drive vaccination policy through the country as quickly as possible. If I can then go to the last slide, and I'll just dwell on here for a moment. I think that we recognize in South Africa that the only way that we're going to be able to combat the challenges of the pandemic and indeed roll out a successful vaccination program is by doing so collaboratively across all social partners, that we can't work in silos, that we need to have continuous engagements, which is why we now have a fully integrated approach between government and business involving indeed labor. As I've already underlined, we've had an issue, in my opinion, in terms of effective communication to key stakeholders and ensuring that we get buy-in from all constituencies and all communities. It's proved to be much more difficult than we anticipated 4 or 5 months ago, and that we're only going to be able to come out of lockdown effectively and start addressing the very, very pernicious issue of unemployment, poverty, and inequality in South Africa, with economic growth, which is not impaired by the lockdown restrictions, as I said. Our future focus at the moment is, as I said, ensuring that we can maximize vaccine demand generation, that we support the whole of society approach across all platforms, that we share data in a transparent, comprehensive, and inclusive manner, that we work collectively, not just in terms of the vaccination rollout strategy, but also in terms of the implementation of the economic recovery plan post-COVID, and that we utilize all aspects of the private sector, formal and informal, across all sectors, domestic and indeed international, if we're going to be able to drive both the vaccine rollout program and the economic recovery action plan. And I think that's the last slide. I hope that I didn't overstay my time.
Well, I think that even if you did, the richness of the data information you provided us is so helpful that that we can live with this overpass, Martin. I think it was very helpful. I would like to highlight 2 elements. First of all, which we did not highlight in our discussion. First of all, the key role of the private sector, and specifically in developing economies. I mean, this graphic, in which you see that 30% of the vaccination effort comes from the private sector, in many ways, is quite illustrative. And I would like to bring that to many of the UN discussions that we have. But we cannot emphasize more that if we are not integrated in an effective and impactful manner, we will not make a difference here. I mean, at the end of the day, the idea of bringing the public and the private sector is a question of achieving the goals that we have before us. There is no way out. And then you have provided us many examples, and we have many other organizations also collaborating. The other element that I would like also to bring is that, and that's quite interesting, and I don't want to deepen in the controversy, but you are recognizing and acknowledging that on a company basis, you have some examples of mandatory vaccination, right, which are needed, and you're acknowledging that. I mean, even though we as IOV perhaps we have some important cautious approach because of the legal aspects, because of the confidentiality aspect, because of many things that we cannot. But you are acknowledging that at the end of the day, in some companies, at the end of the day, we have to protect this approach, and that's what's going on in South Africa. I understand.
Absolutely, sir. Okay.
So and there is also a kind of good exchange also in the staff management. We have to follow it, and we have to follow this conversation. But before doing that, also, and even if we are running out of time, I would like to give the floor to our last but not least speaker, Francois. I hope that I pronounce it properly. Bach, who is the general manager of Switzerland and senior VP for human resources at Firmenich. Firmenich is the largest private-owned perfume and taste company. And from a human resources perspective, you have an important experience to share with us also in terms of how you are putting in place not just vaccination, not vaccination, but prevention at the workplace precisely to return to the work premises. Thank you again, Francois, for being with us, and the floor is yours.
Yeah, thank you very much, Roberto. Good afternoon, everyone. I have the pleasure to conclude this panel by sharing the experience of Firmenich on the front of COVID, but more on the operational, on the ground level. Then just next slide, please. Few facts about Firmenich, who is the leading family-owned company operating since 125 years, 14 acquisition of 5 years. We have now 10,000 plus colleagues around the globe, with 6 R&D centers, 8 facilities, 30 manufacturing entities worldwide, and we're operating in 100 markets. Next, please. Regarding our responsibility for our stakeholder, first, we have set up a creation of Global Crisis Committee at the beginning of the crisis. Having a global presence, we started really to foresee the impact of the pandemic with our colleague in Asia being first affected and learning from these teams. We took immediate response and effective as of February 2020. And our Global Crisis Committee management were set up to ensure that we could take care of all our employees and stakeholders and to guide our company through what became in only a few weeks an unprecedented wave of disruption. Then we have defined 4 levels of risk, and all general managers have been empowered to decide which level of risk should apply to his or her affiliate based on local regulation and having in mind our priority number 1, the people's safety first. The second point is the strict respect of sanitary measures that were implemented to protect our people and to secure business continuity. Our business is considered essential during times of COVID. Then we are part of the global food chain and as well a critical player in public health and hygiene. The vast majority of our customers continued their operation around the world. Food and sanitation supply remain critical. Then we maintained this continuous dialogue and kept our business without disruption. The measure that all the segregation of our supply chain colleague with the other division to avoid cross-contamination. We start with the work from home immediately with distancing, the signage, the mask wearing, and the wash hand culture. And we offer hydrologic gel in all our facilities and cleaning office, labs, and production site up to 8 times a day. Travel ban, restriction to visitor, and most important, we launched long-term safety culture, which led to a sustainable individual responsibility mind shift. Security is the concern of all. Our community responsibility, we are a responsible family-owned company, taking care and helping the community in which we operate was also obvious. Then we partner with local public and private hospital, clinics, and emergency services, donating such as an example, 14 tons of hand sanitizer to Geneva hospitals, clinic, and supporting our community in the fight in this battle. Then the leadership team focus and align has been extremely important on immediate action and demonstrate calm, resilience, quick decision-making, stress management, communication, and many more. That was really important to manage this crisis at the group level. Then this resulted in a greater and simpler, more effective collaboration across the team and the organization. Immediate action has been, that were not a must, has been stopped. And this has been made possible when all individuals in the company make it sound and have a common spirit, reactive instinctively to focus on the basics. Like, by the way, any human beings does. It's really a matter of continuity mindset that we inherited with our long 125 years of existence based on the external crisis that we passed through. A very important point has been the continuous dialogue with our union employee representative. They were immediately part of the discussion and continuously kept informed about the progression of the pandemic and the setup of adapted measures such as the preemptive thanks the unfailing engagement of our colleagues who work daily on site to secure our activities. The care of our colleagues, it's despite the decline of the infection rate currently, not everywhere, but we see that in Switzerland, is still our priority number one. Then, fortunately, we put in place in 2018 already the global flexible work arrangement and IT equipment that allow remote work easily and safely. We did just during a Friday a global test, and afterwards we're able to launch that globally in one shot, you know, to work differently from the Friday to the Monday. And that is still the case, by the way, for many colleagues, and that will continue to be for several months or years. This was very helpful to prevent the spread of the virus and facilitate the compliance of our employees with lockdown measures decreed by governments. For those who were vulnerable and who could not work from home, we did not compromise. As of day one, we required to stay at home to protect their health and avoid any risk. And we did follow up with every one of them. We did not request any partial employment availability because as a social company, we believe that we're fortunate to continue, and therefore we prefer to give this possibility, financial possibility to company they have to make to stop their business and to get such indemnities. Obviously, we communicate very frequently on the measure and the evolution of the pandemic, almost daily or on several times a week at the beginning between local and global communication, keeping all the same level of information, which was a crucial need. We organized several sessions on the corona with our company doctor. That was very important for us because that gives facts to the employee. You listen more on somebody who really knows the topic and is able to answer to a lot of questions, not linked to emotion, but facts. We also organize webinars on physical and mental health that we continue to do. We provide additional service like parking lot open to all employees, childcare service by the company, the HQ Baby Day Center remaining open during the whole pandemic, donation of hand sanitizer for private usage, free coffee, meals, and many more things, because it's very important that during a period of anxiety that you are sharing the effort as a company employees. By the way, just as a result, to give you an example of that, we run, like a lot of company, the survey satisfaction, and just the year after COVID, the highest engagement score ever has been just last year. That showed that even in a difficult environment, it's possible to have a work that even is tough and create anxiety due to the external world and what we are facing, is still possible to create an environment, trust and safety to operate for all our employees. Looking back at the early stage of the pandemics, we can see that a very positive momentum has engaged in the relation between the employees and the company, even strengthening further, and the new ways of working has been established from now. Now, next and last slide, please, the vaccination and beyond. The first point is leverage employer network. It was very important. Then in Switzerland, at the beginning of COVID, many measures were decreed by federal and cantonal authorities, and we all faced questioning and sharing information and experiences as proven to be instrumental to implement the best solution in our companies. Therefore, in this regard, the compilation with the Federation of Companies in French-speaking Switzerland and the group of multinational companies on the French part too has been very key. It took form from key newsletter, outline, webinar, video conferencing to get informed and to share experience. We launched also as a responsible company an easy and sped access to vaccination was really a matter of concern. Then in end with the FAIR, the GEM, the association, Employer Association I just mentioned, and local pharmacists and federal association, a task force to design an in-house vaccination solution. This project has been presented to local authorities, but they have decided to keep on the decision to use the main local vaccination center, which by the way has proven an excellent level of vaccination in Geneva. Then consequently, a pilot with this center has been launched with 3 companies. Our company, MSA and Richemont, has been set up for a dedicated time slot in cantonal vaccination center. And following the success of this pilot, more than 200 employees in Geneva have access to it, and just after the pilot, and that contribute to accelerate the vaccination in Geneva. And you know that in this district, the vaccination rate is one of the highest in Switzerland. The global measure and local regulation, then since the beginning of our crisis management team, we have decided that the action will be based on the global approach of sanitary measure. Then therefore our levels and related measure were always adapted on minimal local government regulation, but frequently set up above them, then better than them, while respecting each local culture. And the discussion that I followed this afternoon demonstrate how it's important to have a global approach, to have your own values, but in the same time, to take respect of the regulation, that's the first, but also the culture of each country, even if you try to take the best of all the worlds to make it happen in your own company. Therefore, for the next step, we would like to have either still a in-house or mobile vaccination solution. Therefore, we're looking forward on this area. We wish to use in-house or mobile vaccination center in Switzerland wherever possible. This action can accelerate the vaccination rate and will be leveraged. We saw that even you have a strong vaccination center in the different districts, in different countries. When you have as an employer the possibility to have your own vaccination or a mobile one, according to the value of the company, you can really create this trust, and that has been proven for our companies to accelerate really the ratio, not enforcing or to have a mandatory vaccination, but just to have a dialogue and create an environment and trust where you feel that the vaccination is accessible, is right. You will not convince everyone, because we know that we have a certain level of population that will never be vaccinated, and it will be very difficult to convince them. But that's contributed a lot, and it was quite significant when you take this kind of action. Another point that I would like to cover is the care, mental and physical health, not to put that aside and speaking only about vaccination, because after 1.5 years of this crisis, all get tired, and it's particularly important to care of what we will provide as a company on mental and physical health support and guidance. Then as an example, we have hired psychologists that they are available for employees, but also team to relieve their fear, anxiety, stress. And on the physical side, we partner with a local hospital, but that is valid in other countries, to provide checkup and health advice. And that gives a sense of comfort, because health is really the center in our action. It's really important not to focus only on COVID, but really the entire balance of your health. We have also, on the third point, ways of working. Obviously, now everything is going faster with a higher decision making, which will request a better active listening and more specific services to employees, because that will shift also the way we manage, we lead, and it will be particularly important more than ever to listen very actively. Finally, on the inclusive capitalist business model that is ours, and as a conclusion, I see that the pandemic has established a new area of strong partnership between public, private, and employer association institutions at local and global level. The past month has proven that working together, combining our ideas, strengths, and abilities, led us to very positive output for the benefit of all stakeholders. And this demonstrates the very positive and efficient impact that a business such as our inclusive capital model may have within our all communities. Thank you very much.
François, merci. Thank you very much. Also, thank you to the fair, I have to say, I mean, because it liaises also as with you, and also to the Union Patronal Suisse. I think your insight also in terms of how you have been dealing with the town. I know that beyond also the success you have also had many difficulties, many challenges, and also I saw also your persuasive approach with vaccination. Also recognition you will have also individuals that will never get vaccinated because they have also the right not to be, and that's something also that we have to respect. I just want to finish this conversation. First of all, thank you to all the participants. I think we have a significant number of participants joining all the conversation. We have received also many inputs of thanks and of thanks because of the sharing of different perspectives around the globe. I mean, that's what matters for IOE. It's not just what we can say to the Secretariat of Employers as IOE, but what you can tell us and how we can put that together. And from that putting all together, we can identify trends and we can identify challenges. And that's what we're going to do. We already did that when we start this conversation. I think, Pierre, it was in June. Well, we started in February, but also we have another event I think it was in June. And now we are going to have, after this one, a kind of follow-up. And in this follow-up, we'll provide you also again some guidance on how we see things evolving. And please do not hesitate to address us. And when I say us, I am not just talking about myself and all the team that have been working on this. Because we will liaise also with other members. We have important experience, not just in vaccination. I want to insist on that, but also in prevention, in remedies, in discrimination, non-discrimination. I think it is a holistic approach in which we can also help you further. Thank you again. Have a nice afternoon, evening for ASEAN members. And thank you to all the participants. Peter, thank you very much to you. And we are looking forward to liaise further. Keep safe, keep connected. And let's return to the premises as soon as possible.